And we're live.
Hello, everyone, and welcome to our lunchtime chat. We're here talking about all things naturopathic medicine residencies with a special focus on what to expect when you land a residency in the teaching clinic. My name is Dr. Brandilyn Binstock, and I graduated from Bastyr University in Kenmore, Washington. I'm currently the Chief Resident at Bastyr Center for Natural Health in Seattle, Washington, and joining me today on the call is Dr. Alex Aponte Davila. He also graduated from Bastyr University in Kenmore, Washington, though now can be found in San Diego, California, serving as the second-year resident at Bastyr University Clinic. Thanks for being here, Dr. Alex.
Excited to be here with you all, and thank you for that amazing introduction, Dr. Binstock. It's a pleasure to be here today.
So, Dr. AD, before we sort of jump in and start talking about residency positions, I just want to take a brief moment to describe both of our practice focuses. So, do you want to go ahead and describe your practice focus or special interest first?
Of course. So I see a lot of primary care. I work with cardiovascular, diabetes. We see a little bit of endocrine, thyroid dysfunction. Of course, there's a lot of GI dysfunction that we observe and we treat, as well as we provide biofeedback. I am trained in IV therapy, which I am one of the supervisors and work with students and help them also teach one of the classes and help them develop this skill as well. Spanish is my first language. I was born and raised in Puerto Rico, so I have this fun love and connection to the Spanish population speaking, so Hispanic. So I'm running one of the community clinics as well, and this residency has provided me with all these opportunities and to work with the patients that I want to see and teach explore more naturopathic medicine, and expand our medicine around San Diego area, which is a great place to be, sunny and very beautiful. I'm having a great time down here.
Thanks so much for saying. Yeah, it sounds like a super exciting residency focus that you have, and also very diverse too. In the state of Washington, naturopathic physicians are also primary care providers, and many do choose to fill that role, including myself. So I have a primary care practice with special interest in gastrointestinal health and hypermobility spectrum disorders. Of course, cardiovascular health and diabetes are also an important part of my daily practice as a primary care provider. And just like Dr. AD, I have special interest in IV therapy and run a clinic shift as well. So every day is a little bit different. And I think that's really the special thing about being a doctor and also a resident in the setting of a teaching clinic. Okay, so now that the listeners know a little bit more about our interests, Dr. AD, perhaps you can talk about what fills your schedule, what your work setting is like. I'm sort of curious about the roles that you have as a second-year resident and also the roles that you had last year as a first-year resident.
Of course, I can. So starting with first-year residency, that they ease you into 7 shifts that you are going to be working with students, but also you'll have a more experienced naturopathic doctor supervisor with years of experience, and you start learning from them, getting accustomed to the clinic. You can, of course, I totally advise of you to start giving your input and finding your way, finding your niche, exploring what do you like, what type of patients are you seeing that you really resonate with. Also, there's some type of administrative work, so you need to meet with the chief medical officer every other week or every week, depends on the busyness of how busy the shift is, the clinic is, as well as you want to meet with students, do mentorships. I brought up I run some of the clubs, still participate from the differential diagnosis club. So I was still involved with student life, but at the same time, I was trying to find my identity as a doctor, as a new doctor. And the residency provides you those tools and that opportunity to find yourself, but at the same time, keep learning and also have that mentorship with more experiences doctors. So 7 shifts. and some admin work and helping with ordering any of the materials we use in the clinic, start getting involved with the front desk and learning how they do the scaling. So there's a lot to do, and I recommend you to be proactive and own your own learning experience. I wish Bastyr University Clinic San Diego will provide those opportunities. Also, as a first year, going back to the mentorship, they provide me with the opportunity to be a speaker in a conference in the AAMP, which is our professional conference, which was a great experience for me and give me a lot of knowledge and recognition in the profession. And then also teaching classes and TAing classes. And I really, if you're thinking about doing a teaching clinic, you should have that passion to teach, right?
Mhm.
That's just a given. So that's what I did the first year. Now in the second year, I'm taking more about the role of teaching more classes and handling my shift alone. I have a lot of team care shifts that I run with students without any other supervision. So you'll get there, and you'll learn a lot in this process for sure.
Yeah, absolutely. I completely agree with you. The positions between the two sites, they are quite similar. As a first year resident at the Seattle clinic, you spend most of your time on faculty paired shifts, as you were saying. So you are supervising medical students and seeing patients, and also you're directly supervised by the attending physician. You also have one shift of private care practice where you're seeing patients one-on-one. And then starting in the winter quarter, you sort of take over one shift where you become the attending provider. But of course, you're still, like Dr. AD said, you're still engaging quite regularly with your mentors. And then as the second year resident at the Seattle clinic, you take over more of the shifts as a supervising physician. You maintain your private practice, and you also start a rotation at Health Point community clinic sites throughout Washington. And finally, as the chief resident in the Seattle clinic, the rotation at the community clinic is complete, but you continue to maintain your teaching clinic shifts and your private practice. And then also a chunk of your time is in your schedules devoted to either a research project or others. So because my passion is in teaching, I spend a lot of time on the university campus lecturing and helping out with classes. And both Dr. AD and my schedules are very diverse throughout the week. And I think that is an aspect that I just love about these residencies at the teaching sites in particular. Which reminds me, just last week, someone had asked me what my favorite part of my job was currently. And I love that question so much because it really gets you to reflect on the things that you're grateful for and the parts of your job that really ignite you. And so, Dr. AD, I'm curious, what is your favorite part of your last year plus? I know there's so much to sort of...
Yeah, totally. But and it's a great question. The favorite part of this is just seeing the students graduate and see them as doctors the next year. And I had that experience this year as a second year, and I see my colleagues being doctors, or seeing that progression, even in first year, seeing that quarter to quarter, and see them progress as doctors and see them manage their cases alone without that much help after I mentor them, or we mentor them as a team, because this is a whole team that we're working and teaching with the students. And for me, that's my favorite part, seeing them growth and seeing them shine by themselves and ignite, giving them that light, but then see them being self-sufficient and being great doctors and working up their cases and looking research and putting up their treatment plans without my assistance, right? But we're here to guide, and I really like that part. That's what makes me keep coming back and be happy and see that progress and know that we're putting out there great doctors in the community that will put our name and the profession, the naturopathic medicine profession, out there and pride.
Gosh, I really have to completely agree with you. my favorite part is also working with the medical students. It truly is what makes a teaching residency unique. I think they show up so excited and with diverse interests, and they put loads of research and work into those interests. And they often bring these perfectly sorted and summarized stacks of research to shift that I get to receive like a beautiful little gift that it is. And I think it's just a real privilege to be working alongside them. And they also keep you on your toes. And I often feel like I'm learning just as much as I'm teaching when I'm surrounded by the medical students. So I have to agree, that's definitely my favorite part as well. Okay, so before signing off, I know listeners have questions about what it's like being a naturopathic doctor in California. Can you talk a little bit more about your scope of practice in California and maybe touch on your quality of life working and living in California?
Totally. So I did my medical school up there in Bastyr, and now I'm in San Diego, so I got to see both differences in the terms of the scope. One of the main things is that down here in San Diego, insurance is not covered. We're not covered by insurance, but we can apply for some type of maybe medical, which is a type of healthcare, to at least labs and imaging, and some services can be covered for the patient, but not all the insurances, or it's harder to get insurance cover. In terms of scope of practice, also, you can do IVs, you can do some type of primary care, but we don't have pharmaceutical prescription rights as in Washington State. So that's something we can do with oversight of a medical doctor or a DO. I believe so. I'll probably need to double check on that, but for sure, medical doctor oversight, which we have in this site. So I feel comfortable doing some type of primary care because I can prescribe some medications as needed. So I can do antibiotics, any diabetes medications, blood pressure medications I can manage. So that's something that we still can do. In terms of without that oversight, you can still prescribe hormones like levothyroxine or epinephrine. You can do some other hormones, not. And then if you want to do testosterone, you need a DEA license. I feel that's in the same in Washington State, regardless, but you can without MD oversight here in San Diego. And this is for this year. Of course, these laws are always dynamic and they can be new every year. So I do invite you to check in with the California Naturopathic Association and make sure you're up to date with any changes that happens every year. And in terms of our scope, but that's what I've been experiencing so far, and I haven't seen any limitations. Another one is the medical procedures. We're not allowed to do it without supervision of a medical doctor, and that means any suturing, any incisions, anything that needs an incision, or minor surgery, you need an MD oversight as well. I think those are the biggest aspects of the scope of different. But you can order labs, you can still diagnose, you can prescribe any supplementation, and you have a lot of benefits as well as a medical provider or healthcare provider.
Yeah, I'm really happy to hear that there's access to labs and imaging that can be covered for your patients, and also that there is access to prescribing pharmaceuticals, because that certainly is a big part of our curriculum and part of our practice here in Washington, as you know, working up here during your medical degree. So brilliant. Okay, and then any additional insight into sort of like what your life is like in California and San Diego outside of practice?
Yeah, well, this is great. It's a great place to live. It's sunny all the time, and there's amazing beaches and nature. The culture I really resonate with, and California has been great so far. In terms of the quality of life and work-life balance, has been good. is work, as you know, you need to put some work, but there's always ways to check in with your mentors. And this clinic has been very good checking in with us and making sure we're doing all right, and that we can keep going and we're being healthy. So work-life balance, at least for myself, has been a big factor. And I recommend you, if you end up being here, we take care of ourselves here. We make appointments. I go to the chiropractor here, that we have a couple. I do go to the IV shift here and do my own nutrients, and with supervision of another doctor, of course. And we take care of each other. So that's culture in this clinic is good. And we check in with each doctor, checking with each other, and we're being very good about being a good community about and taking care of each other. I think that's about it. I do want to add, in terms of the type of shifts that we have homeopathy, we have an autoimmune shift, we have IV shift that we already talked about, we have biofeedback shift, we have physical medicine shifts. So we have a lot of diversity in terms of the specialty shift that if you're interested, you can just be the resident that shift for a couple quarters. And there's a lot of flexibility in terms of you expressing your interest, and you can maybe be in that shift more often if that's your interest, and that aligns with the clinic's needs as well.
Great. Well, that certainly sounds ideal. And, in regard to the specialty type shifts, I think there are similar shifts across campuses between Seattle and San Diego. That's another part of the residency that is super helpful, because if you do find, like you said, your niche, you can really spend a lot of time just kind of like delving into that one thing and getting really good at it and getting lots of experience. So it's quite helpful to have those specialized shifts. Okay, well, it looks like we've hit our time mark here. Dr. Ady, thanks so much for jumping on this call with me today. I know that your insights are super valuable to the students who are currently making decisions in regard to which residencies they're applying to. Thanks all the listeners that joined us live today, and everyone who's tuning into the recording. We hope you all have a lovely rest of your week, and we look forward to seeing you all next quarter. Bye-bye.